Thank you for watching this video training from www.intouchemr.com, the fast, integrated, and easy EMR. Visit our website for a demo and a free executive briefing on the 5 blunders to avoid with EMR.
Hey everybody, this is Nitin with InTouchEMR.com, and in this training I'll tell you what to look for in billing reports. Billing is the engine, the cash flow engine of your private practice. You want your billing to be simple, streamlined, and efficient. You want your biller to be empowered with the billing software that not only allows them to check eligibility and perhaps auto post ERAs like we've talked about in other trainings on this channel, but more importantly, you want your biller to be able to do sophisticated things like scrub the claims before submitting them. You want your biller to be able to not only auto post ERAs, but bill the secondary insurance with the click of a button. You want your biller to be able to generate a detailed but very simple patient statement. You want your biller to be able to post a patient payment. You want your biller to be able to do all those things and simplify billing. But what's most important for a biller? What's most important for you as a practice owner to make sure that the biller is doing their job correctly? That's a billing report. Now, there are many different kinds of billing reports. There's what's called as the insurance aging report, which allows you to keep track of how much of your money is out there. You know, do you have certain payers that are slow in paying you? Do you have certain providers that are not billing as much as other providers? So there need to be sophisticated measures and a lot of customization. This is really important. There needs to be customization in the reporting function, and this is exactly what we do at InTouchEMR.com, our billing component of InTouchEMR.com. First of all, you should be able to look up your accounts receivable and break it down by different metrics. What do I mean by that? You should be able to break down your accounts receivable by payer. So for example, you know if Aetna is taking 2 months to pay you on average, that's not good. You need to call the insurance company. You need to get that stuff fixed. If you need to look at your accounts receivable by provider, some providers may be slow in submitting their documentation, which of course results in you not getting paid. As a practice owner, you need to be able to break down the accounts receivable by location. You need to be able to break down the accounts receivable by ICD codes, by CPT codes. You should even be able to capture reports that tell you how much you've been paid, and you should even be able to keep track of how much the patient has paid. You should be able to keep track of reports, accounts receivable by actual patient. So being able to pull up accounts receivable reports by payer, provider, location, ICD code, CPT code, by patient allows you to know exactly where your money is coming from. Imagine being able to pull up these kind of reports yourself as a private practice owner and not having to depend on the billing staff to do it. Imagine being able to pull up these reports in a certain time frame for the last week, for the last month, for the last 6 months, broken down by these categories so that you know how much you're getting paid, how much of your money is out there, so that you can essentially have a meeting with the biller or have a meeting with, in some cases, your provider and say, look, this doesn't look right. This doesn't measure up with the rest of the metrics in our practice. Imagine having these kind of billing reports in your practice and the power and the ammunition it gives you to be able to look at your practice at a high level and say, look, this is what we need to do to be able to make more money. These are the metrics that help run your practice. These are the metrics that will tell you whether you need to change the way you're doing things. These are the metrics that actually might tell you, listen, we need to stop working with certain payers because A, they're taking too long to pay. B, they're not paying enough. B, you may need to have a word with the provider if the provider is not billing correctly. C, you may need to have a word with the staff at the location to let them know, look, we don't seem to be doing as well as the other location. You'll actually find out which ICD codes are making you the most money. So you can actually market accordingly. You can, if you're making more money with certain ICD codes and you're able to bill more per visit, you may want to market to patients so that you get more patients and you target patients with that specific ailment, you'll know which CPT codes are allowing you to get reimbursed more. You'll know which type of patients you're making more money from. The level of sophistication in your billing reports is going to be directly related to how successful you are as a practice owner. If you want more information about the kind of sophisticated billing reports that we can generate in our EMR and with our billing component, with our clearinghouse, go to intouchemr.com so we can give you that information. Also, when you come to our website, we'll actually give you an executive briefing on the 5 blunders to avoid with EMR. Whether you choose to work with us or not, that report alone will help you simplify, streamline, and automate your practice. I hope we get a chance to show you the power and the potential of the fast, easy, and integrated EMR over at intouchemr.com. Thank you so much for watching, and I hope that you've understood what to look for in billing reports and how to use it to make your practice a streamlined and profitable machine that feeds your lifestyle, that you run and that doesn't run your life. Thanks so much for watching.
Thank you for watching this video training from www.intouchemr.com, the fast, integrated, and easy EMR. Visit our website for a demo and a free executive briefing on the 5 blunders to avoid with EMR.